Well, if you played sports as a kid, chances are you twisted an ankle a time or two. And the older we get, we can twist an ankle just walking. Well, luckily, there are doctors who specialize in getting us back on our feet, literally. We've introduced you to Arizona Sports Medicine Center before, and today we have Dr. Peter Mitchell joining us. He's a foot and ankle surgeon to talk about how common some of these injuries are. And it's so good to have you here on Sonoran Living.
Thanks. Good to be here.
Yeah, good for you to be here because, you know, we talk about this all the time. Oh my gosh, you breathe wrong and something hurts. But
Right.
Before we get to some great tips that you have to offer, tell us about Arizona Sports Medicine Center and how long you guys have been around, what you do.
So we've been here in the Valley for 20 years, and we have docs that take care of hand injuries, foot and ankle, like myself, sports injuries, shoulders, knees, hips, just about any body part from the orthopedic perspective we can handle.
Okay, that's really good to know because we're all going to need you eventually. And I know it's sports medicine. Often we think, oh my gosh, I'm not a pro player. I can't go there. But you treat pro players as well as the rest of us,
True.
right?
Yes, we take care of the Diamondbacks, the Cardinals, Phoenix Rising, as well as many high schools. I'm involved with a lot of the minor league teams. So
okay.
We do a lot of that, but we also take care of people who were athletes many years ago and
Right.
have conditions related to that.
Yes, and we all do, right? We've all been there. Let's talk about some of the common foot and ankle injuries that you see. What are they?
So in sports, you'll see fractures and sprains, Achilles ruptures. So some of them can be treated non-operatively. Some of them need to be fixed depending on severity.
Okay. And, I think most of us who've been athletes back in the day, we have a tendency to live with the pain, right? And that's really not acceptable. Tell me, what would be your best recommendation for somebody who's been just living with the pain and maybe just can't take it anymore?
Yeah, so I think if whatever you're living with, whatever malady is tolerable and you take a few Advil and you're fine the next day, then that's fine. But if whatever it is keeping you from doing activities that keep you healthy and happy, like your significant other says, let's go for a walk, and I can't because of this, or you can't wear shoes anymore, or only very few shoes, something along those lines, then it's probably best to be evaluated. We have problems when we wait too long.
Right.
It makes it a lot harder to fix and less predictable.
Why do we do that, Dr. Mitchell? Why do we wait?
Denial, or fear. People are afraid of coming in to see us.
Hoping it's just going to get better, and it doesn't, right?
Correct.
So walk me through what a consultation might be like, because let's take some of the fear out of it, right? What can we expect?
So basically we start with just taking a history, talking to the person, getting to know them. What are their goals? What is it they can't do? What is it they want to do?
Okay.
And what sort of treatment they've had so far. And then there's always imaging. We'll get x-rays. Sometimes we get an MRI or a CT scan depending on what the issue is.
Okay. And surgery, certainly that's on the table, but prevention is part of it, right?
Oh, for sure. Yeah. We try not to operate if we can avoid it. Some things absolutely need it, and some things there's conservative treatment that we can do. A lot of conditions are progressive. Arthritis gets worse over time. People, if they've got significant arthritis, they eventually need surgery to address it.
Really? Okay. Really good information, as always. Thank you so much, Dr. Mitchell, for being here. And
you're welcome.
And don't wait, you guys. If you're suffering with pain, you can reach out to the doctors at Arizona Sports Medicine Center. You can call the number right there on your screen, or you can scan the QR code or visit their website, asmcmd.com.